Welcome to the third module of Integumentary Alterations. We will continue with Chapter 27 of your textbook, and we will be discussing benign tumors of the skin, skin cancers, and other skin disorders. After this lesson, you will be able to teach all patients how to perform thorough skin self-examination to monitor for skin cancer, teach all patients ways to reduce risk for skin cancer, identify key features of benign tumors of the skin, support the patient and the family in coping with changes in skin integrity and body image, and identify key features of melanoma and other skin cancers. Benign tumors are normal cells growing in the wrong place at the wrong time, also identified as altered cell growth. We are going to discuss a few of the most common benign tumors. One of these is seborrheic keratosis. It is common in older patients. It is a benign epidermal neoplasm. It occurs mostly on the face, the neck, the upper trunk, and/or arms, and they may be removed for cosmetic reasons. The thing to remember is these are not skin cancers. Another benign tumor is keloid. This is an overgrowth of scar tissue. There is an excessive accumulation of collagen. It is more common in patients that have darker skin tones. Some key factors that can lead to keloids are surgical incisions, burns, and ear piercings. Treatment is difficult for keloids. Surgery is usually combined with intralesional steroid injections and/or low-dose radiotherapy. After this procedure, pressure dressings are applied, and then they will wear elastic dressings for at least a year. Another benign tumor is a nevi. It is a benign growth of the pigment-forming cells. Often it is referred to as a mole. It appears with regular, well-defined borders. It generally has a uniform color. Approximately 50% of malignant melanomas actually develop from moles. Suspicious moles will have irregular borders, they will have multiple colors, they may have bleeding, and they may be very itchy. Another benign tumor is a verruga, also known as a wart. Generally related to a papillomavirus infection. It is raised, has a flesh color, and has a rough surface. It is often found on the hands and/or fingers. Plantar warts on the bottom of the foot can be very painful. Treatment can include surgical excision, cryosurgery, and/or topical caustic agents. The last benign tumor we will be discussing is hemangiomas. This is a blood vessel tumor. It is also referred to as nevus flammeus. It generally develops congenital. It usually appears on the face and the upper body. It is a pink to a bluish purple appearance. It does tend to fade during the first year of life, except for the port wine stain. Treatment generally consists of surgical excision with grafting. There could be laser therapy and the possibility of using opaque makeup. Okay, let's discuss skin cancer. Overexposure to sunlight is the major cause of skin cancer, although other factors are associated. On page 502 of your textbook, Table 27-6 provides information that is related to the most common skin cancers. We are going to discuss a few of the most common skin cancers. Actinic keratosis is a premalignant lesion of the epidermis, and it may progress to squamous cell carcinomas. Another skin cancer can be a squamous cell carcinoma. That is cancer of the epidermis, and it usually invades locally. It has the potential to metastasize, and risk factors can include repeated injury to areas or irritation areas. If it happens on the ear, lip, or external genitalia, it's more likely to invade or spread to other areas. Then we had the basal cell carcinoma. This is cancer of basal cell layer of the epidermis. There usually is destruction of the underlying tissue and vital structures. Some risk factors include genetic predisposition, chronic irritation, and UV exposure is the most common cause. Okay, let's discuss melanomas. Melanomas have a high morbidity and mortality. They're colorful moles in shades of red, white, and blue, commonly found on the upper back, the lower legs, or on the soles of the feet, palms of the hands for dark-skinned people. This is a pigmented cancer of melanin-producing cells. There is a genetic predisposition. One risk factor is excessive UV light exposure. Greater incidences usually occur in lighter skinned patients. Usually there is a presence of one or more precursor lesions. Melanomas are highly metastatic, and early diagnosis and treatment are very important. If you note here in this picture, there are color variations within each lesion. Cases of melanomas have increased in the past 30 years. It accounts for about 2% of all cancers and accounts for about 1% of all cancer deaths. You have a higher incidence of melanomas in light-skinned races, patients that are older than 60 years of age, individuals that like to work outdoors, and those that live in higher altitudes. Chart 27-12 on page 503 of your textbook provides client education information in regards to skin cancer prevention. The non-surgical treatment for skin cancer is drug therapy and radiation therapy. Drug therapy can consist of topical chemotherapy creams and systemic chemotherapeutic agents. Radiation therapy is limited to older patients, and it's a deeply invasive basal cell tumor. And those that are poor risk for surgery are the ones that get the radiation therapy. The surgical interventions include cryosurgery, curettage and electrodesiccation, and excision. Cryosurgery includes local application of liquid nitrogen. They will apply hydrogen peroxide to clean the site. Post-cryosurgery, the lesion may become a blister and they will clean it with water. With the curettage and electrodesiccation, local anesthesia is given. This is provided for small lesions with well-defined borders, not melanoma. The dermal curate to scrape away the cancerous tissue is used, and then wounds heal by second intention. Excision is used for the large and poorly defined borders, and then skin grafts are used if tissue destruction is deep. StevensJohnson Syndrome is another skin disorder, and if you ever see this, you will never forget what it looks like. It is a drug-induced skin reaction. Can range from mild to severe. It appears as a mix of vesicles, erosions, and crust. It can become life-threatening. Severe involvement involves respiratory problems, excessive fluid loss, renal failure, and/or blindness. Treatment is to remove the offending drug. This completes this lesson. If you have any questions related to course content, notify the instructor.